right, now you know what you got to target. Now we're going to go do some fixes here. I'm going to be going through some anatomy, real simple stuff, just as we go through here to try and better understand what we're trying to do. When it comes to trying to mobilize the foot especially, let's say you were stuck, you were down, you wound up that posterior cord, you try and pull their toes back, and you're real stiff on one side compared to the other. The big thing that we're trying to evaluate, this is what ends up leading to most plantar fasciitis, ends up being shortening of the tissue within the arch. There's a lot of different reasons that you can get shortening of tissue. The most frequent thing that we tend to be finding is more fascial adhesion, a lot of restriction in the actual tissue in and of itself, to where these, on the bottom of the foot, we don't really ever think about it, but it's almost like a deli sandwich. There's layer after layer of tissue. There's the skin, there's plantar aponeurosis, there's plantar fascia, there's flexor digitorum brevis, there's quadratus plantae. There are all these layers of tissue. Now the thing is that as you go through normal movement and ambulation, these layers should be able to slide and glide and do their job independently. What happens is that as time and repetition comes by, repetitive bouts of swelling, your body wants to try and make this more durable. The way it's going to make it more durable is it's going to lay down connective tissue. It's going to lay down scar tissue. It's these little sticky white cobwebs of connective tissue that build up between layers of tissue. Now what happens is that this stuff starts to get stimulated due to hypoxia. Hypoxia is a decrease of oxygen perfusion in the tissue. That's because of repetitive bouts of swelling. It's almost just like callus formation. Your body lays down thickened tissue in the area because it interprets high load. High load means it wants to make you more durable, so let's lay down some more stuff. So the big thing that we want to try and do more than anything is try and reestablish that normal sliding of these layers. And we want to try and break up some of the adhesion and allow this for more elasticity, for better shock absorption. Because if this stuff turns into one big wad and that tissue doesn't be able to slide, can't slide side to side, what's going to happen is all the load that gets hit here now gets dumped and now hits the attachment in the heel bone. This now becomes inflamed. Now what everybody does when this gets inflamed is they start then icing this like crazy. You roll it on a frozen bottle of water, you're mashing it into everything. Stop mashing things into the swollen heel. It is swollen and irritated. Stop pushing on it. What you want to do is you want to ice it and rest it, but the key is the way to make the swelling go away for good is you got to quit pulling on it. So by loosening up the tissue in the arch, you reduce the overall pulling, so you quit feeding the fire and this thing then dies out. Capiche? So what we're going to do here is we're going to take the ball. What I use is a lacrosse ball. We love these things here. They're a multitasker. You can work on pretty much any part of your body if you can find a mean way to get on this thing. So what we want to try and do is we're going to take, and you want to work between the balls of your feet and the actual heel bone, and you want to scan and you want to go real slow and very detailed. So what we want to try and do here is that I'm going to show Katie how to kind of get started. You take, depending on your flexibility, if you've got it in the hips, the way that I do it, because you want to go slow, is you wrap around your whole foot, take that ball in your pads of your hands, and you drive it into the foot itself. That way you can actually control the amount of depth and pressure, and then you can slowly kind of roll side to side. Now you're not just doing this willy-nilly rolling all over, you're being specific and detailed. The more methodical and detailed you can be, the bigger results you're going to get. So when you get in here, you want to dig and you want to work, and when you find something you don't like a lot, you want to hold it right there. There's the face, there's the face. That's therapy. That's what pain is progress. So once you hit something you don't like, you stick right on it. And now you stay here and you just give it a little bit of time. Give it 30 seconds to a minute. It will change. It won't go away. This will not feel wonderful. But if you give it enough time, what will start to happen is that it'll start to change the shape. Once it changes, now you got to move. You stay right on that knot and you pull your toes back. And you curl your toes while you're on the knot. So what you're doing is you're stabilizing one layer as you're now drawing the other layers by it, to be able to restore that normal sliding of tissue, and you're also breaking up a lot of that adhesion in there. Then once that gets nice and loosey-goosey, you relax and you go looking for the next spot. So you're going on a seek and destroy mission. You're trying to scan that whole area out side to side, go all the way down into grid pattern. Don't push on the swollen heel. Okay? The other thing is then you can, if you don't have the flexibility to get into it like that, you can do it a little bit more slowly, side to side, control it. Don't just stand there and do the golf ball thing like everybody always does, and they're just kind of doing this random mashing. That just hurts. You're not changing anything, you're just irritating things. Make sense? Another simple stretch is that you can try and stretch this tissue. You take that foot, what you do is you stabilize the heel with the heel of one hand, reach over the toes, grab onto the arch, and then you peel those toes back. Now what you do is you want to now do a contract relax. This is the most effective way to lengthen a tissue. You don't do one long hold. Recent research has shown it's almost a 22-minute hold you got to do to actually get anything to lengthen. If you've got that time, more power to you. But what you want to do is you want to wind this up. Now you want to take the toes and try and curl them up, but your hand will not allow that to happen. So you're contracting the muscles in your arch. So push into your hand. Contract for about 5 seconds. And then as soon as you relax, you can go back a little further. As soon as you relax that tissue, you get a window of opportunity where you can sneak in there and now you can get this thing to loosen up a little bit. Now you hold this new spot for about 10 seconds. And you contract again. You're trying to curl your toes up, but you don't let them move. And relax, and now you can go back a little further. So you just inch it back. Minimum dose is 2 minutes. Contract, relax for 2 minutes as you stretch. Make sense?
Does.